And hi, everyone. TJ All's I-45 now in Galveston now. It's been a while since we've been with you with Dr. Philip Keiser and what you need to know. We're glad to have you on as we talk about a lot of healthcare issues. Obviously, we'll lead off with COVID, but been a little over a month since we've been able, our schedules have matched up again. So, Dr. Keiser, thanks for coming on. We do appreciate you coming on as always. Let's get right into it. This is going to be a shorter show here today, folks? Dr. Keiser does have to get out at 3:00, but wanted to take a look at things of where we stand with COVID-19. Here it is, in May of 2020. Obviously, it was starting to make a surge. We had no vaccines at the time and no real treatment levels. Then last year, the vaccines were starting to roll out about this time last year is when folks outside of that kind of 65 plus range could start getting their vaccinations along the way. And where we are at now. So why don't you kind of go over with us of where we're looking at data wise. And obviously we're going to focus a lot on Galveston County, where we are on the number of COVID cases. And are we doing better now? Are we falling behind? What's going on there?
Well, we're seeing numbers go up again. And in many ways, that shouldn't be surprising to us for a variety of reasons. Number one is that we know that during May, people are out and about a lot, in our county. We have Mother's Day, we have Memorial Day weekend, we have Jeep weekend, and we have tourists coming back to the island. And so, there's a lot more exposure going on. And this is happening all over the country. Airplanes are full, people are traveling, record travel over Memorial Day weekend. And so it's not surprising we see the numbers go up. And then on top of that, we're dealing with a more infectious virus than we were a year ago or 2 years ago. And the Omicron variant is clearly much more infectious. We're in the second version of the Omicron variant at this point. So that's the bad news. The good news is that even though it's a more infectious virus, it does not seem to cause as severe disease. And just for an example of that, we had our first death reported in about 6 weeks last week. And so during that whole period of time, not a single person died in Galveston County. In addition, hospitalizations are not as high as they have been at similar periods where we've seen the numbers starting to go up the way they are. So as of this morning, we had 6 Galveston County residents that were in the hospital. UTMB has about 23, 24 people with COVID in their hospitals. Overall, that's a low number. Now, that being said, it is disconcerting because we are seeing the numbers go up. They're starting to go like this. And so we can expect to see a lot more cases. The other thing we're worried about is the availability of home tests. And the home tests are great. If you're worried you have COVID, you can test yourself. But when that happens, people aren't reporting it to us or to the state. So we do believe that our sense of the true picture of the number of people getting COVID is not as good as it was. And so we're missing a lot of cases. But that being said, we can follow the hospitalizations. And of course, as we've discussed before, that's one of the big indicators that we follow.
One of our viewers kind of brought this up right now. I thought it would be good. Janie Russell brought up, it's just like the flu. It's here to stay. That's actually somewhat truthful along the way in that there's been no indication it's going to disappear at any time. And so that's where it goes into, all right, we're now into that next phase of dealing with this in everyday life, is it not?
That's right. That's right. No, that's absolutely right. We are in a different phase of COVID, and we're in the pandemic, and we're in a different phase in 2 ways. The first thing is that the virus has changed, and we've seen this happen over time in the past. If you look at the great flu epidemic of 1918, which killed not quite as many people as COVID has killed, but the population was a lot smaller in the United States then, but killed lots of people. Over time, that virus attenuated, and that attenuation started to be seen about 2 years into the virus. Okay, and so now we're 2 years into COVID, and what are we seeing? We're seeing the virus has changed, and so it's not causing as severe disease. That's number one. But 2, our technology's changed. I mean, we can detect it very easily. We have vaccines and we have treatments for it. And I think that's the most important thing, because we have treatments now that we can give people. You don't have to go to the hospital and get an infusion. You can simply just go to your doctor. He can give you a prescription, and it works wonderfully well.
Right. And when you talk about that prescription that's available is, in many ways, what we're talking about is Paxlovid.
That's
And
correct.
at one point early on, it was hard to find. The
Yeah,
supply
that's right.
levels were not there. Where we stand now with Paxlovid, is it available, and how come can someone get it if they do test positive?
Yeah, so Paxlovid is widely available. There's actually, if you just Google Paxlovid pharmacies or Google Test and Treat, you can find a website which will tell you which pharmacies in your community actually have it. And most of the Walgreens pharmacies and CVS pharmacies have Paxlovid. There's another drug called molnupiravir. It doesn't work quite as well as Paxlovid, but that's also widely available. And but all of these drugs require a prescription, so you have to go see a healthcare provider, and they'll evaluate you to make sure that it's going to be safe to give you this drug. And so with Paxlovid, the big concern is that it does interact with some other medications. So if you're taking certain medications and you take Paxlovid, it may increase the levels or it may decrease the levels. And so you need to either have a pharmacist or a doctor look at that and say, oh no, drugs you're on, no problem, you're okay for Paxlovid, or I'm not sure about that. Maybe Paxlovid's not the best drug for you. Maybe you need to get the other pill, molnupiravir, or maybe you need to get an infusion. All right. And these are, again, the decisions that need to be made between you and your healthcare provider. That being said, the government has set up what's called Test and Treat. And this is basically, you can go into a Walmart pharmacy and there, I believe, I'm not sure if it's CVS, but there's another one as well, where basically you can walk in, you say, I don't feel good, can I get a test? And they'll go ahead and they'll test you right there. And if you're positive, they'll say, oh, you're positive, here is the medication. And they'll give you that medication right away. Yeah.
So, yeah, that was something when you and I were talking about before we went on the air, that test and treat procedures. How soon do you think we'll see that a little more widespread? Right now, you can go into some pharmacies and they'll test you and say, all right, here you go. You don't need to wait for a prescription. Take this.
Right.
How close are we going to see that on a more regular basis?
Yeah, well, we're working, so I don't know what you may have your own doctor who can get you in right away and test you and give you a prescription. Okay. So, I first talk to your own doctor, but we're actually working on something with UTMB and the health department to set up sites to do that, where even if you don't have a doctor, you can just walk in, get your test done, and then leave with a prescription. That's probably going to take us a couple of weeks to work through. Needless to say, it's a different way of doing things, and there's some kinks we have to work out. But we want to make it so it's widely available and people have no problem getting it anywhere in the county.
One of the things also when we talked about, those cases dropping down, the hospitalizations, even those that are going into the hospital, you were telling me they're getting out faster than we would have seen a year ago.
Yeah, so it's much fewer people ending up in the ICU, and that's been very clear throughout the Omicron wave. But also, people are not spending 2, 3, 4, 5 weeks in the hospital like they did. Often they'll just be in for a few days, get some fluid, get some medication, and then be able to go
home. Now, also to talk, an interesting article I read in the New York Times over the weekend was that even someone who had not had COVID symptoms are vaccinated and were asymptomatic, but they're finding that what would be considered long haul symptoms of COVID are existing in folks. Everything from the brain fog to later on getting the loss of some taste or smell or the like, that well past the time they were positive for COVID. Can you talk about it? Because you said that that's kind of a thing that's being looked at closer now.
Yeah, I mean, this is a real phenomenon, and one of the things is that vaccination doesn't necessarily prevent long COVID, and in many ways, these symptoms shouldn't surprise us. COVID gets into the brain. We've known that from very early on, and when it does, it can cause changes either through inflammation or through directly affecting the brain and affecting the way that things are wired. So even people that have been vaccinated are still having symptoms that persist for a long period of time. And people are having problems with senses of smell and sense of taste and fatigue. And lasting for greater than 6 months. We're actually looking at this in the county, and so we sent out a survey to Galveston County residents who had COVID, and we tried to get a representative sample of all around the different cities where people were, And we're just getting the data back, and we're seeing the same things that they've seen in the New York Times article that has been published, which was really sort of a compilation of articles. The other thing we're seeing is a lot of psychiatric symptoms, people that have a lot of anxiety, a lot of depression. And with that, we're seeing, a lot of disruptions in families and disruptions of family relationships, and sometimes even family violence in people that have had long COVID versus people that didn't have those symptoms. So, the effects of this, I think, are going to be long lasting in some folks. And I think it's important that we understand those so that we can both plan for the future and also figure out ways to treat people that are showing those symptoms.
And you brought that interesting point up, because that was another part of this article. And you're right, it's based on some articles around the way. It was kind of a collection of, but that the stress levels, they say stress is already up across the board in the U.S. That depression is up, and they say it in some cases it directly related to isolation that was caused, but that there may be some chemical imbalances that are come from this too. That's being looked at finally as a long-term deal from this. We're not saying because someone got COVID that they've turned violent or anything like that, but it's kind of all-encompassing of what goes along with that. How much are we been missing out on really? I take it is that COVID forced us to finally take a look at a lot of other issues health-wise that maybe we didn't do before, kind of the all-encompassing whole health studies on things instead of one thing at a time.
Right. Well, I think that's very clear with COVID. And I think part of it is because we realized just how disruptive this was to our lives. When this whole thing first started, we thought, okay, well, we'll lock ourselves down for 3-4 weeks and then everything will be done. Right. And boy, was that wrong. But we're also learning that as we've gone through a lot of the social isolation and the economic problems, that it has bred other issues. And so sorting out how much of this is due to COVID, how much is this due to the fact that we've turned our economy topsy-turvy, how much of this is due to the fact that that people are frustrated and angry. We're seeing rises in gun violence and in murders, and yet not other types of crimes. So clearly people are on edge, right? I think we can say that very clearly. And how much of that is actually due to the COVID itself versus the situations that came out in terms of our response? I think it's going to take us a long time to figure that out. But I think it also highlighted just how bad we are at really looking at people's overall health, because decisions were made, we need to do this right away. And we didn't think about the secondary and tertiary effects of that. And we've learned that we really need to address issues such as, people having chronic illnesses, because people with chronic illnesses did more poorly every time they got COVID, and that's true with any infection. And people with chronic illnesses don't do well from a psychological or social point of view. But that's true of every type of chronic illness, right? But we don't talk about it that way. And we've also learned that we need to get out into communities and meet people where they are, and not just have these medical centers where we do things, and health department where everything's kind of siloed and we all do our own thing. We really need a much more integrated approach to health in America.
And you brought up something about the mental health aspects of this, and not to get into the political aspects of what had happened in Uvalde a week ago. But as we have now seen that, and a statistic that, gun violence is number one cause of death now, children under a certain age. But I want to get into more of the mental health approach, because that's the one echoing thing we heard from the governor and others. We need to take a better look at mental health. Right. You are the local health authority for Galveston County. You head the health district. How much resources are available for mental health in our region?
Yeah, well, the answer is not very much, and that's true across the country. In the 1970s, the federal government dismantled the the psychiatric hospital system, and for good reason too. People were just sent away. It was like a prison, and in fact, in many ways, worse than a prison. And so the idea was that let's get people back in their homes and treat their mental illness. And unfortunately, the treatments and the networks to do that never materialized in the way that they were needed. And so this is something that's a big problem all across the country. So here in Galveston, we have Gulf Coast Services, which provides mental health services, and it's actually supported by the federal government, supported by the county commissioners, much like Coastal Health and Wellness. And I got to tell you, for the first time in years, we're actually sitting down with them and we're saying, okay, how do we coordinate our efforts? How do we leverage what each one of us does? And I think you're going to see more and more of that, of trying to make these services available so that, if you have a kid in crisis, who might go off and do something that nobody wants them to do, that maybe you can get that kid in, get somebody to talk to him and see if those things can be helpful. And let's face it, this has happened here. It's happened at Santa Fe. And so I think that's being able to have not only just mental health services, but also an awareness that these things do exist, and there are adults and kids who somebody needs to tap on the shoulder and says, hey, come on, you need to talk to somebody about this. This isn't right. You're going down a path you don't want to go down. And we don't have that available anywhere in America, as far as I know of.
Well, let me have you clarify something here, because as health district's been around for a good while.
Yep.
Gulf Coast Center's been around for a good while. But you're saying for the first time in like a very, very long time, the two are coming together to talk about shared resources. How come that took so long?
I can't answer that. I've been with the health district about 5 years, and obviously my role has changed over time, and the head of Gulf Services is new as well. And I think we kind of looked at each other and said, hey, we need to do this, and I can't speak to why those things didn't happen earlier, but we see that we can provide some things that they can't. We see that Coastal Health and Wellness can provide some things that we can't. We also see that they can provide some counseling services and other things that Coastal Health and Wellness can't, and services that the health department outreach can't. So, it's crazy, right? Why didn't this happen sooner? I have no idea. But I know it needs to be done, and I think we'll all be better off for it.
That just shocked me to hear that news. That I think it was a given. I don't think I'm alone. I think folks thought, oh yeah, this is already happening.
Yeah.
But go ahead.
But just to speak to that a little bit, TJ, I think we had a really great COVID response in Galveston County, but a major reason for that was that the county government, the health department, the major healthcare providers all recognize the need to work together. And one of the things that we're trying to do now is make sure that as we move into the new wave of COVID and move into the post-COVID era, that we don't forget those lessons, and that we continue to leverage those resources that we have available to provide the best services. And it's going to be a struggle, because the easy thing to do is kind of retreat back into your own little world. But it's something that definitely needs to be done.
And along the same lines, though, it gets into, all right, you get this cooperation base, but if someone comes in, are they going to be able to find the help that they need?
Right.
Because there's just so many limited resources. Gulf Coast Center is about it. There's some other private sources. UTMB has a very limited availability for mental health. Although I think we're going to see that boost up too, with the expansion on the center for family health and violence, and also to the new school that the medical school is going to happen on population health that we talked about a few weeks ago. But do you see that capacity can it meet the capacity? Is the capacity there to meet what demand is coming?
No, I don't think capacity is there to meet the demand, but I think their steps are being taken to try and address that. So, for example, UTMB is now getting some inpatient beds, which they haven't had since Hurricane Ike. So that's a step forward. We're looking at collaboration between, UTMB, Gulf Coast, and the health district. The county judge will set up veterans courts for veterans who have mental health issues to try and divert them out of the legal system into the into mental health treatment, and now they're actually looking at developing responses for 911 for mental health calls that don't initially involve police, so that you would have mental health workers go and people that are skilled and trained to work with people that have mentally ill and in crisis, to try and de-escalate the situation and diffuse things so the police don't have to get involved. So I think across the board, what we're seeing is that there's a real recognition, and I think you're seeing a lot of efforts in a lot of places. Is it enough right now? No. Do we need more? Yes. Is this a start? Yes, it's a start. And as long as we can start and get things going, then we continue to build year by year by year, and hopefully we'll get to where we need to be.
Yeah, I look back, since we just had the 4-year anniversary of the Santa Fe high school murders, right, and shooting, that at the time everyone said, well, we need to look at mental health, and then look at mental health. We need to look at mental health. Not much changed. Right. There was some changes, some concentrations in Santa Fe, for example. Counselors brought in. Gulf Coast Center doing a remarkable job there. Where they could. There's counselors on staff now that specialize in mental health. We've had mental health deputies for Galveston County for many years. The Gulf Coast Center, as I mentioned, been around for a while. But that change in approach hasn't really taken part of a hold of a culture. So that is something that probably more see down the line. I know I don't want to press it too much. I hope your folks are supposed to meet with you 3. We're going to let them know that you're going to be a little bit behind here because we got some other stuff. Getting back into you're the boss now. You can tell them to go ahead and wait. But let's get into back on a COVID subject, because just the health stuff, the mental health stuff, I wanted to make sure we were talking about there as well. But one of the things to talk about, summertime is here. We're seeing cruise lines get busier. I was asking you before I went on, hey, I'm going on in weeks myself, but I was looking at some statistics I got from the and it actually really surprised me when I saw this, because the first thing you think of on a cruise ship sometimes health-wise is, man, you're bunched in with a lot of people and everything else. But that, according to the CDC, that at least nationwide on the cruise ship operations, less than 1% infection rate with COVID-19. Right. Is that matching up with, I know you look at some of the data too, is that matching up with what you've been able to see there too?
Yeah, no, so they send us data too, and we look at it, and we're able to monitor things so that if something happens, we'll be aware. But in general, I think cruises are still one of the safest places to be. And you think about it, that makes so much sense. Pretty much everybody's vaccinated. 97, 98% of the passengers and 100% of the crew. And then everybody has to get a COVID test before they get on board, so it doesn't get much better than that. And when we have seen cases and where people have gotten it on board ship, usually, or presented on board ship, let me put it that way. Usually when we discuss things with the cruise lines, the people had symptoms prior or had an exposure and got on during their incubation period. So again, none of this is very, very surprising. There was a lot of concern with the Omicron variant that because it is more infectious, it would spread very rapidly through the cruise lines, but it really hasn't happened. So I'm still pretty comfortable with telling people that I think that the cruise ships are a pretty safe bet for your vacation right now. Of course, it always can change, right? And then of course there's always that, that incident that nobody anticipated or planned for where people could get exposed. But right now it still looks pretty good.
Let's see. As I say, it was a personal question for me, but I'm sure there's others out there who want to know. We always get the questions about the cruise ships when we talk about COVID too, all the time. Speaking of something else that's kind of made the headlines a lot here, monkeypox.
Oh yeah,
out there. And I to tell you the truth, it had been a long time since I even heard of monkeypox. I remembered it in early studies and all. It's making some news headlines and the like. And can you kind of give folks, Are we, concerned? I had someone ask me the other day, this is like Planet of the Apes all over. We had COVID, now we have monkeypox, and this is how it starts. I said, no, I don't think this is how it starts. But anyway, can you just kind of address that of
Sure.
what we think, of how concerned should we be? Are we seeing anything here locally that we need to be concerned about as well?
Yeah. I don't think the general public needs to be concerned. I think as public health officials, we need to be concerned because we don't want it to take hold. All right. But just to give people some background, so monkeypox is a virus. It's similar to smallpox. It exists mainly in monkeys, but it can transfer to humans. And they've had outbreaks for the past 40 or 50 years, mostly in West Africa. And it can be transmitted to other people, usually by very close contact. You'll find that a lot of people that get it had sex with someone. And it's not sexually transmitted. It's just that close contact is how it gets transferred. And it has mainly been confined to West Africa. And about 1% of the people that get it get severe cases and die. And so, that's about what we're doing with COVID right now. What had happened most recently was that there was an outbreak linked to a festival in the Canary Islands. And apparently there was a lot of partying going on and a lot of quote unquote close contact. And those individuals that were affected went back, and a lot of them went back to Spain. And so there were some secondary cases in Spain. And then some of them actually came to the United States. So there were at least 2 cases that flew in and from Europe. And with them now, I think there have been up to like 7 or 8 potential cases. None of them completely confirmed, at least when I checked at the end of last week. And I haven't seen that there have been secondary cases in the United States. We actually had a potential case here in South Texas. There was someone who had been on an airplane right next to a guy who was a confirmed case. And so as soon as he got off the plane, the CDC notified the health authorities in Fort Bend County, and they quarantined him. And they kept him locked up for about 10 days. And during that period of time, we had a lot of conversations going back and forth. Well, what happens if he actually gets it? What happens if he starts developing the blisters? What do we do with him? And so, we had a tentative plan that we would move him down to UTMB into the biocontainment area to make sure that he was isolated. And then if he got sick, what would we do? And, and how do we work up contacts? And so in many ways, COVID was a good exercise in figuring out how to address these things. But also, I think it really hammered home that, we basically get one shot to stop this stuff in its tracks, right? And so, everybody from our point of view, from a professional point of view, we wanted to make sure that this guy did not represent a threat and was not going to transmit it to anybody else. And even if he got it, he would get it. We'd take care of him, but we wouldn't let him give it to anybody else. And it turns out he never developed symptoms. He was let go. He was able to go on his way and actually flew back home without any problem. So, that's kind of where we are with monkeypox. We may see more cases, but I think from a general public point of view, there's not a lot of risk at this point.
Also, too, just in case the wild chance that someone would contract that, it is not often serious illness or fatal, correct?
That's right. Right. So think of it. The best analogy would be like a case of chickenpox. That's one of the things they always teach us in our first year of medical school, how to distinguish chickenpox from smallpox, even though smallpox doesn't exist anymore. They look a lot alike, but they also have very characteristic findings to them. And so, it looks like chickenpox. People can be sick for, they get sick for 4 or 5 days, and then they develop the rash, and then some of them, and a very small number, develop respiratory symptoms like within chickenpox and can get really, really sick. And then a very, very small percentage of them die. We don't know what the death rate would be if it occurred in a Western country. We have therapies that are not available in many of these African countries. Plus, we have better supportive care, so we think it won't be as bad. We've said stuff like that before, and we're wrong. So we don't think it represents a major public health threat at this point. But there is a reality in that this is one of the biggest outbreaks that have ever occurred. And that if something has changed about the monkeypox that makes it more transmissible, we may see more cases.
Yeah, such as it seems to be more human to human than people had
Right.
anticipated
Yeah,
in the
that's right.
past,
That's right. That's
based
right.
on things as
That's right.
well. So,
Yeah.
another thing to be considered, go from monkeypox down to skincare.
Oh
I
yeah.
guess it's a different form of that. It is summertime as well, and obviously,
Yep.
folks getting out of the water. We've had a lot of folks down on the island this past weekend,
Hmm.
and folks heading up to the lakes and the like and enjoying themselves. What's the best advice you give folks about watching after their skin
Yeah.
when they're out and about?
Yeah, well, wear a hat, wear long sleeves, wear sunblock, do all of those things. And there's no reason not to. I mean, sunblock's readily available where you do the highest level you can. And if you're going to be out in a boat, there's less certainly. You can go to a sporting goods store and buy an SPSF shirt that'll block the sun and help protect you. And that's the most important thing. And well, why do we worry about those things? Because we worry about skin cancer, we worry about melanoma. And even a bad sunburn can lead to increases the rate of people developing melanoma. And so it's later in life. We don't want bad things to happen to people.
And then also another summertime pest, the mosquitoes. But
Uh-huh.
obviously, we're always concerned about West Nile and then Zika
Yep.
too,
Yep.
which but outside of a few years ago, we heard about Zika left and right. We haven't heard
Yeah.
much in the last several years, and West Nile too.
Yeah.
Is there, what are the best advices for folks there just to protect themselves?
Yeah. Well, so first of all, I have things like West Nile. West Nile comes and goes, right? And we have some years when we have a lot of cases, and some years when we have almost no cases. And particularly when I lived in Dallas, something funky about Dallas. It seems to attract viruses. West Nile, St. Louis. I think one of the first cases of Zika was there. They had Ebola there. I mean, it's just if you're afraid of viruses, stay out of Dallas. But
yeah, the Dallas Tourism Board is really loving you right now. You know that, right?
Well, hey, come to Galveston. But so it comes and goes, right? And then we have viruses like Zika, which just was rolling over the Caribbean and South America, and we actually had to get to our shores, and we had some outbreaks, but we never had that subsequent next step. And a lot of it had to do was that people in the South American and on the islands developed herd immunity. And unfortunately, we haven't seen that with COVID, but they developed herd immunity to Zika. And so Zika didn't spread because there weren't enough people there to come here to give it to us.
Right.
But West Nile is still out there, and again, there are other viruses out there. So again, what do? You avoid the mosquitoes, particularly where use DEET, cover up, long sleeves, high collars. If you're going to be out at night, use mosquito repellent, and there are lots of devices that you can buy that work extremely well to help prevent mosquitoes coming around. So mostly right now, mosquitoes are what we call a nuisance. But there are mosquitoes out there that can spread disease. And so it's best just to get in the habit of avoiding them. So if and when that thing does happen, it doesn't happen to you.
Dr. Philip Keiser, the local health authority and also CEO of the Galveston County Health District, been on with us. As I said, it's been a little while here, and be a little bit longer because when our next schedule is up in 2 weeks, I'm going to be out of the country, and so we'll catch up the week after there, hopefully, and go along that. And thanks for the info as well. We appreciate it. Again, if you have a question or a topic on any healthcare subject you'd like us to talk about next time, just email us here at I-45 Now. We've been more glad to talk to you about. Thanks for coming on, Philip. We appreciate it.
All right. Good to see you. Have a great trip.
Thank you, sir. You've been watching What You Need to Know with Dr. Philip Keiser here on I-45 Now and Galveston.